Okay. Hey guys, good evening. Good evening. Thanks everyone for joining. It's Fertility Talk again. It's Wednesday, so Fertility Talk. And today we are talking to Dr. Deo, Dr. Tebogo Deo. She is a director, fertility specialist and director at Genesis Fertility Clinic. And we're talking about frozen transfer and fresh transfer. What's the difference with it? Is there better success rates with it? We've got quite a few questions. If you've done any transfers for any IVF lately, if you've done IVF lately, and you've maybe have a question regarding that, or are you going, if you're going to be doing IVF soon, and you have any questions regarding that, please let me know, and we can ask Dr. Deo if we have time at the end of the talk, if we can ask her. So I'm going to invite Doctor now. There we go. A few seconds to join us. Can join us. No. Hey, Dr. Deo, how are you?
I'm good, and you, Leanne?
Good, thank you. Always lovely chatting to you.
Same here, same here.
Okay, so we're talking about IVF. So I think I haven't given you that question, but I think for those listening, like I always say, we always have new people joining us that is just maybe starting their journey. Maybe we should just go through what is IVF and just explain that it's a lot of times people don't understand, women don't understand it's actually using your eggs and your partner's sperm in most cases. So
Okay.
maybe we just want to go through that for the ladies. But before we do that, that's the first question, sorry. But before we do that, please introduce yourself, tell everyone who you are and where you're from, where you're based. Please.
Hello, everybody, and good evening. I'm Dr. Tebogo Deo. I'm a fertility specialist based in Pretoria at Genesis Reproductive Center. We are based in Kloof Medi Clinic in Pretoria. We are present also on social media and online as Genesis ART, but you can also find me as Dr. Tebogo Deo on my website and on Insta and Facebook as well.
Awesome. Thank you very much, Doctor. So again, as we're saying, we are talking about fresh transfer versus frozen transfer. And it's always a question of which is better. But before we do that, let's talk about what is IVF. And when would they need IVF?
So, in vitro fertilization, which is what IVF is, means that fertilization simply means fertilization outside the body in the laboratory. So, in vitro means in the laboratory, whereas in vivo means inside your body. So that just means combining an egg and a sperm outside of the body, and that there may be several reasons why that needs to be done, be it female factor, male factor, combined factor, single couples, same sex, whatever the reason may be, that fertilization takes place outside the womb. So there's quite a few conditions under which a couple or a person may find themselves that they need to undergo this treatment.
Okay, perfect. Then our first question with this is, what is a frozen transfer?
Okay, so what is fresh versus frozen transfer? So usually when we do in vitro fertilization, we will stimulate the lady with hormones for a number of weeks, 2 weeks or just over 2 weeks. And then after that time, we would then aspirate the eggs, fertilize with the sperm, and then we would either transfer immediately, which is about 5 days. When I say immediately, I mean after growing the embryo in the laboratory for a short period of time, and which is 3 to 5 days, that is fresh. Or we may actually freeze the embryos either day 3 or day 5 and then transfer later, a month or 2 later, depending on why we needed to freeze.
Okay. And then what is a fresh transfer?
Okay, so fresh transfer, like I said, that is when after the eggs have been aspirated, within that same cycle, the embryo is then transferred while it is still fresh. So we don't first freeze it and keep it in the tank before we put it back in the womb.
Okay. Okay, what is the difference between the two, as in the advantages and the disadvantages with fresh and frozen transfers?
So simple things would be like fresh cycle is obviously shorter, and if conditions are perfect, you have a short time to conception. Should you be one of those that are fortunate that you get to fall pregnant within this first cycle, and
Yep.
therefore your level of stress and anxiety is less, and the cost will be less because there's no freezing fees, and you don't have to wait longer, and you don't have to now pay an extra fee for frozen cycle. So that is just the simple economical, socio-economical advantages of one over the other. And then medically, it depends on the conditions. Whether we go for fresh or frozen depends on a person. It's not something that we just like you can just choose like that.
Yes.
You know, made less than 10 eggs, we might decide to go with the fresh transfer, provided the uterus is fine, provided the medical condition is fine, and provided you don't want to do genetic testing, because unfortunately, currently we are not able to do genetic counseling, genetic testing within the same cycle. It will take about 10 days, unfortunately, to get a genetic results. So during that time, while we're waiting for the results to come back, you would need to freeze the embryos and wait. And then there's conditions where uterus is not fine. So if the uterus is the condition of the uterus is not okay, like there's fluid in the cavity, the lining is too thin, or we think that the receptivity of the uterus is out, if the uterus is out. For example, if a person has made too many eggs, then we may have to look at frozen. There's conditions like polycystic ovarian syndrome, where people who are at risk of hyperstimulation syndrome, where we then recommend that it is better for them to have a frozen cycle. So where we wait for the body to get back to normal, and then we will then in a month or so prepare the lining then just for transfer.
Okay. So, is there one that is better? Like, would you normally recommend it? Was it just dependent on the patient itself? Or is there better like results that you guys have found when it comes to frozen transfers versus fresh, or fresh versus frozen?
So there's advantages in terms of success rate. It depends on the patient profile. You know, we used to think that fresh is better. Then there were studies that showed that frozen is better. So the literature is quite conflicting out there. But we know that frozen embryo transfer in general, there's better implantation rates. You know, there's studies that have shown that there's less chances of miscarriages, there's more chances of pregnancies that will ongoing, as well as live birth rate. But with possible side effects like large for gestational age babies, preeclampsia, those are the things that we look at as the cons for frozen embryo transfer. But in general, it depends on the person. There's no one size fits all.
Yes. Okay. Would my doctor offer both options? But I think you kind of answered this question, saying, would my doctor offer both options, or would it be depending on certain factors? But like I said, I'm going to ask it, but I know you have mentioned it.
Yeah. It depends on the condition. If I was doing IVF with a patient and I look at the follicles that are formed, we do aspiration, we get 20, 22 oocytes that are retrieved, I'll probably go for a freeze-all cycle. So usually when we look at your AMH is quite high, more than 2, we would already pre-warn the patient that you stand a chance that you might hyperstimulate. We will definitely tailor your dosage such that you make fewer eggs. But should you make more than 15 eggs, then we would then sort of prepare them that you will most probably go for a freeze-all cycle. So, and then after freeze-all, we will go for a frozen embryo transfer. When the level of your estrogen has come down, your body has recovered, we have done whatever it is that we need to prevent or to treat hyperstimulation syndrome should you be unfortunate to develop this condition.
Okay. And probably in older women, is it more, would you then rather say a frozen would be better? also? Is it more that that women that are older in the late 30s or 40s are told to rather have a frozen transfer?
So I wouldn't just put it on age. I would look
Okay.
at your progesterone level at the date of trigger.
Yeah.
And if your progesterone level is high, then it tells me that you most probably will be out of sync in terms of your endometrial receptivity. So in such a patient, then I would then recommend that we go for a freeze all and then we do a frozen embryo transfer as compared to doing fresh at the beginning.
Okay, thank you very much, Doctor. Is there anything, any tips or something that you want to say to the women with regarding those that's going to do IVF soon or will be going on this journey soon?
So if you're going on an IVF journey soon, I wish you all the best. It's very stressful. So take
Yeah.
time, really have a buddy, somebody that can celebrate with you. Celebrate each and every milestone. I always tell my clients, if when you have raised funds, that's something to celebrate. You know, once you have responded well to treatment, something to celebrate. When you go for aspiration and we find eggs, because sometimes we go and you find empty follicles, there's no eggs. So if you find, celebrate. It helps to alleviate the stress when fertilization takes place like that, so that should you get to a point where now the pregnancy test is negative, the stress is not as devastating because you've had all these milestones that you have celebrated. Should you find yourself in a situation where you have to do frozen over fresh, believe you me, sometimes it is better to go that route of frozen as compared to fresh. Your doctor will obviously advise you accordingly. And also remember that IVF, there's no guarantee that you will fall pregnant the first cycle. So you must be in it for the long haul because anything is possible. And I really wish you all the best and God bless you in your journey.
Thank you so very much, Dr. Deo. It's always lovely speaking to you. And thanks for taking the time out. I know you just came out of surgery, guys. She just came out of surgery and she's ready for us.
Yes.
So thank you very much. We really appreciate that. I'm just want to see, I'm still coming for my IVF, Dr. Deo. So I've got one of the ladies saying she's still coming for a IVF with you soon.
Yeah.
And then Rizana is saying, I love celebrating the milestone comment. That's absolutely beautiful. Yeah, I've never heard that before. So thank you for that. And we wish you a lovely evening and thanks for always availing yourself to all the ladies here.
Thank you very much, Leanne, and thank you for having me. I hope that it has been helpful tips for the ladies and all the best to you all. And remember, never lose hope. There's always something that can be done for you.
Awesome. Thank you. Dr. Deo is available. She's at the Genesis Fertility Center. They are in Kloof. I remember I was there in Kloof in Pretoria. And it's a lovely center. I've met everyone there. So, guys, if you want to get hold of her, they are on Instagram. They've got a website, Genesis Reproductive Center, Genesis Reproductive Center in Pretoria. And you can also find them on Instagram, Facebook, as well as they've got a listing on Fertility Solutions site. So please, you can contact them there, or you can even just leave a comment or pop us an email and I'll give you Dr. Deo's contact details. So thanks everyone and have a lovely evening. Bye.
Thank you. Bye.